Let's get started. I know we're going to get a number of people joining us, but we want to go through our opening things. So first of all, thank you, all of our participants who are joining us here for our first Shift series event. Shift used to be a Greenlight Fund actual physical gathering event, and we've shifted that to this virtual series. It's a three-part series this fall. Of course, we have an excellent panel today discussing tools for dramatic change using data, policy, and voice to fight child poverty. Our next two sessions are November 10th and December 8th. So we'll give you the info at the tail end of the convo, but please hold that for our later conversations. My name is Rishi Maudgil. I'm the executive director here at Greenlight Fund Detroit. And I wanted to give a special thanks to our implementation partner, Strategic Community Partners. SCP is a national firm that works with organizations by advising, designing, and managing projects and initiatives that advance equity with and for communities. In other words, they share our values. And even better, they're based here in Detroit, and we're proud to have this incredible Black woman-led and owned firm as our partner here for this series. So thank you, SCP. So let's talk about the Shift series. So a little background on Greenlight Fund. So Greenlight Fund, we partner with local communities to identify urgent needs facing children and families that have barriers to social and economic mobility. What we then do is, working alongside a community-centric process and alongside folks in the community, we fund highly effective national programs that are expanded here through local leadership and that complement the existing landscape of efforts that we have in our community and try to increase impact over time that affects our residents. So we're part of an amazing national network of 10 cities and growing across the US. And I want to give special thanks to our Greenlight Fund founding sponsors and founding advisors who have all helped us get here today. So why do we call this event Shift? The reason is, just like in Greenlight Fund, we're convening residents and leaders who are actively shifting the way they do things, the way they use partnerships, tools, platforms, and power to achieve tangible benefits and results in the community. So these virtual Shift panels approach timely and relevant issues through a racial equity lens and demonstrate the impact that we have collaboratively by doing community-minded work and running fair and authentic processes that way. So thank you for joining us today. A couple logistic things for today on the webinar for our guests and attendees. We will have moderated-led Q&A after our initial discussion with our panelists, and at least 15 minutes at the end for just audience participation directly. We'll end at 5:15 p.m. At any time, you can use the Q&A feature at the bottom of your Zoom panel to submit your question. We'll be aggregating those questions throughout the session. And in the meantime, feel free to use the chat for any reactions you have. That chat box, again, is at the bottom of your Zoom. And be sure to set that to everyone, not just host or panelists, so that everyone can participate and see your comments. Finally, to view captions, please click the live transcript button at the bottom of your Zoom window, and then you'll be able to see subtitles throughout our session here. All right, now let's meet our incredible panelists. Thank you again. These are our Greenlight advisors, Greenlight Fund advisors and supporters. As I was saying before, this is a similar space to what Greenlight Fund does. We convene folks from across the city, both leaders and residents, and debate priorities that are important to us collectively. Today is about a critical issue that we spend a lot of time on, and that is how to create dramatic changes for children facing poverty. And like in Greenlight Fund, we have to really balance both hard data, empirical research, as well as listening to people and getting direct feedback and putting those components together for creating policy and making decisions around programs. So our panelists are going to talk and walk us through some of those big decisions. We didn't use the language dramatic change lightly, There are some huge things happening locally and nationally, as you might know. And these are folks that are at the front lines of that, where we can really make a better tomorrow for our young people. So I'm incredibly happy to introduce our panelists. Our first is a longtime servant of the people, CEO of COTS and an integral life coach, Cheryl P. Johnson. Thank you for joining us. We also have the Herman and Amelie Cohn Professor of Social Justice and Social Policy, who's also Associate Dean at the Ford School of Public Policy and the Director of Poverty Solutions at the University of Michigan, Dr. Luke Schaefer. Thanks for joining us, Luke. And then a longtime public servant who I could also list many things, currently most of his time being spent being the Deputy Mayor of Detroit. Thank you for joining us, Conrad Mallett Jr. And finally, our moderator for tonight, who leads Detroit Future City as CEO, is Anika Goss. So thank you for joining us. Each panelist is going to have an intro question from Anika that they'll spend several minutes talking about some of their core work. And then we're going to have a discussion with them and all of you. So I'm excited to get started. Hand it over to our moderator, Anika Goss, again, who leads Detroit Future City. Anika and her team recently released a report on the state of economic equity in Detroit. So thank you for moderating, Anika. Please help us set the context for poverty in Detroit, especially as we consider disparities by race and for our children.
Rishi, thank you so much for having me here. And I am so honored and excited for this discussion today with this amazing panel of leaders that are working to create change for Detroit's children. And so I'm just going to share a little bit of data to sort of set the stage. And one of the reasons that I'm using the data this way, because when we consider child poverty, we really have to consider the interconnectedness of the conditions of families, right? Like children are living in households, and households are affected in multiple ways that impact child poverty directly. And so to start, one of the first things that we are watching really closely at Detroit Future City, well, to start, 43% of children are living below poverty in Detroit. And that is in comparison to the US, where only 17% of children are living in poverty. And then the median household income in Detroit, and these are just the sort of the basics, is about $38,000, which is $16,000 less than white Detroiters. So African Americans are making about $38,000 for the average median income, and white households in Detroit are making just over $60,000, about $63,000. The African American life expectancy is 7 years younger than whites in Detroit. 54% of Detroiters are renters, but 56% of those renters are considered cost burden, meaning that they're spending more than 30% of their income on rent. And only 17% of Detroiters have an associate's degree or higher, limiting their earning potential by half. Low-wage jobs right now are really the only growing jobs in Detroit for Detroiters. And if we only focus on the job, it still doesn't solve for growing wealth in areas such as home ownership, entrepreneurship, savings, and other kinds of investments. And really what it is that these are the things that we need to do to create the opportunity to stop generational poverty. You can't pass on a job to your child or your grandchild. We have to really consider, what does growing wealth look like in Detroit? So I wanted to share some of those statistics, not just to be the Detroit Future City bearer of bad news, as I've been aptly named sometimes, But really, some of this data is to help us understand the context of this conversation this afternoon, that solving for child poverty has to be, it can't just be focused solely on programs only for children. That until we are actually focused on the full complement of what a family needs in Detroit in multiple ways, we will not be able to create the kind of dramatic change that the Greenlight Fund is really discussing. And so I really am excited to really get into the conversation itself. We need to understand the impact of this data, and Dr. Lou Schaefer is going to help us do that from Poverty Solutions. We also need to understand the deep, intractable problems and how they are being addressed. And Cheryl Johnson from COTS is going to have us do that today as part of this discussion. And we need to understand the role of the public sector solutions and the city's role and their engagement in solving for child poverty. Everyone has a role in making sure that we are all focused on the same thing at the same time. And so, well, we have Conrad Mallett from the mayor's office here today to help us do that. And I'm so excited. So without further ado, I know that wasn't a full 8 minutes, but I'm more excited about what you all have to say than what I'm really talking about. And so I'm going to turn it right over to Dr. Luke Schaefer. I had to look at your information again, Luke. It's like, oh, that's right, he's a doctor, because we work together so much and he makes himself so accessible all the time. But a few years back, you published a book titled $2 a Day, Living on Almost Nothing in America. And that brought some of this data to light, and it was distributed to lawmakers and was really the inspiration for Congress to pass the expanded child tax credit this year. Could you talk a little bit more about the dramatic effect of this and other federal legislation this has had on our children and what policy decisions we should be paying attention to?
Yeah. Thank you, Anika. And it's great to be on the panel with you. And at Poverty Solutions, we really value our partnerships with the Detroit Future Cities, the Racial Equity Data Group that I know Pat's sitting on, and the Housing Compact Advisory Board in particular. And we love Greenlight Fund. I've really enjoyed the opportunity to be a part of evidence-based and values decision-making. Also, so many great partners here today. COTS was a really important member of our report at Poverty Solutions called Investing in Us. The initiative I run really thinks that scholars and policy nerds like us at the University of Michigan should start by listening. And so that work really tried to gather every community-based report that's been published in the city of Detroit and do a meta-analysis. And COTS was one of our great partners on that. And Conrad and our partnership on economic mobility, one of the things we've really been excited about is the community health corps that we've been a part of, just a small part of informing this bigger effort by the city. So I hope we get to hear a little bit about that. My book, $2 a Day, really started with my partner, Kathy Eden, and we decided to bring two forms of data together, using big data, spreadsheets, large surveys and administrative data, along with getting to know families and really asking them questions and asking them to teach us. So that book was about families who weren't just poor by American standards, but were really, really, really poor, folks who didn't have access to cash money. Sometimes families are able to get food assistance, but our cash welfare program in the United States had really declined over time to be a tiny fraction of its former self. We went as far as to say in a lot of places, welfare is dead. And we wanted to know the consequences of that. So we got to know families in Chicago, in Cleveland, in Appalachia, in the Mississippi Delta. And we could have done this work in Detroit too, getting to know families, understanding the deep hardships that they face, and the incredible spirit of figuring out how to do right by your family and making ends meet, and the strategies of keeping families going. So out of that book, we really started to think about what all of this meant. And we could go to the large data, and we saw this big increase in families who were reporting cash incomes in a month or a calendar quarter or even a year below $2 per person per day. We started to think, like, what could really have an impact? And we think more programs helping to provide jobs, that's an important piece of the puzzle. But as Anika mentioned, that's a piece of the puzzle. It's an important one, but we also have to think about the whole family. We absolutely have to think about housing, and the affordable housing crisis is one, in our own work that we know it's an incredibly important issue in the city, especially around tax foreclosure over the last many years. It's also a huge issue in rural areas in the United States too. So getting a handle on affordable housing, we think, is important. And we really came to believe that a cash safety net was important. So we started to look around and think about what kind of programs could really help stabilize families so they had enough money to pay for, maybe pay the rent one month or pay the utility bill, or buy toothbrushes and toilet paper that you can't buy with food assistance, or school clothes. And it turns out many, many other countries have what's called a child allowance or a child benefit. And the principle of this policy is very simple. Raising kids is expensive, and society has a reason to come alongside parents in that work. And so the government policy is a simple one. It says we're gonna come alongside parents with money. We're gonna come alongside parents with a small stipend every month, maybe $250 per child, $300 per young children where you're eating up diapers. And we're not just gonna do a program for extremely poor families, a program that might be stigmatized. We're gonna have one program serve both kids who are really, extremely poor, and kids in families where the income is middle income. Because we know there's actually a lot more dynamic nature between those groups. They're not as different as we might think a lot of the time. And we know that all kids are important. And so this policy treats everyone the same, and it makes sure that nobody is not treated fairly. So we wrote a paper together, my co-author Kathy Eden and I, in about 2016, along with 8 other colleagues. And if you ever want to talk about herding cats, let me tell you about working with 10 academics to write one paper. We wrote this paper arguing for a child allowance, and we thought we should convert the child tax credit. The child tax credit that up until last year was not equitable. About 30% of kids did not get the full credit. And it was about 50% of families with Black children that did not get the full credit. And we thought a policy should start with treating everyone fairly. So we made this suggestion, and we figured out what the poverty reductions would be: 45% drop in child poverty, 50% drop in child poverty among Black children, 60% drop in poverty among Native American children. And we put it out there, and I remember, when it started, a lot of people thought, well, this is a nice sort of pie in the sky type thing that professors can do that can't ever become law. But some members of Congress had been thinking along the same lines, and they built on that proposal in their own ideas, and they introduced what was called the American Family Act that did exactly what I just described. In the first year, it had a handful of sponsors, but over time, what had been pie in the sky became something that had pretty much every Democrat in the House and every Democrat in the Senate. And then COVID hit, and we know the crisis that was COVID. It hit families with children far more hard. Everybody was hit hard, but families with children were especially hard hit. And so is the Biden administration, then the Biden presidential campaign, we're looking around for things that we could do with families. They came along the child tax credit. And in the American Rescue Plan, they passed 1 year of this program. And the results have been staggering. After 2 payments, our colleagues who wrote the initial paper with us at Columbia University finds child poverty has been cut by 30%, pulling 3.5 million children out of poverty. That's transformational. And food insufficiency, the number of adults with children reporting they don't have enough to eat in the prior 7 days has also fallen by 30%. It's even bigger among low-income families, 50% among low-income households who receive the credit. That's incredible. So this is a universal policy of low and middle income families, but not everybody gets it. And that's been part of the exciting work in the city of Detroit, is to make sure it's more inclusive than anything we've ever done before, but we have to make sure families know about that so that they know what they need to do to get it. And so in Detroit, we've had a particularly strong group of partners: United Way, the city, Kresge, Skillman, Kellogg, Balmer, the Balmer Group, Community Development Advocates, CDAD, the County Aid Society, Wayne Metro, just to name a few, who have started the work of trying to make sure people know about this and that that families get it. And the White House has called it one of the strongest campaigns in the entire country. So there's a lot of work to be done, but it is possible to make a difference and move policy from pie in the sky to a reality.
Thank you for that. That is really powerful. I had heard that as well about the 30% reduction in child poverty. I didn't realize that, the genesis of it was right here in our backyard. That's really incredible. That must feel really great. I'm going to pivot to Cheryl. Cheryl, who's a wonderful family friend also, that I'm so proud to know, my mother's friend, Cheryl Johnson, who I've also known for many years, but I don't get credit for that. You're my mother's friend. You have been an amazing pillar in this community, doing work for families experiencing homelessness to reach self-sufficiency. A couple of examples include the launch of Peggy's Place, and which is a family-only shelter, as well as creating permanent supportive housing. You've had a lot of feedback from families that helped inform COTS to move beyond just emergency shelter to permanent supportive housing. If you could maybe talk a little bit more about that transition and the impact it's had on children facing poverty and homelessness.
Thank you so much, Anika, and certainly the opportunity to share the importance of the voice of our families, which is so critical, not only on their behalf, but certainly the impact that it has on the future of our children. So let me respond to this in what I describe as a breakdown of the iterations or phases of hearing the voices of our families, shifting to listening, from hearing to listening, and then amplifying the voice, and how it's informing our work here at COTS. So I've had the privilege of being with this wonderful organization for 31 years. And I think that's why you referred to me as a pillar, because after 30 years, I guess you become a pillar, I guess, and that's a compliment. Okay.
It's precisely 30 years when you become a pillar.
So for 31 years, and because of the longevity, I get to experience things just a little bit differently than others. An example of that is, so several years ago, I began to hear parents, and I emphasize that as in more than one, would talk about their memory of being at COTS when they were a child. Keep in mind that they're talking about this as adult people with their own children now. So this is a full generation later. And on top of what we were hearing, we were now seeing families that represented more than 2 generations, sometimes 4, meaning grandparent, and child, all at the same time in the shelter. And so hearing and seeing this resulted in a major transition at COTS. Our transition from theory to practice included expanding beyond providing housing to addressing homelessness, which is, as we know, a symptom of poverty, to addressing the varied complex causes of generational poverty. And the only way to get in front of this and to really have generational impact for us was to focus our resources and collective energy on families only. So on January the 1st, 2014, our emergency shelter, which at that time provided housing for single men, single women, and some families, we shifted to a family-only shelter, which you refer to as Peggy's Place. And our definition of family is any adult, doesn't matter the gender, accompanied by a child or children. And what accompanied this transition was the creation of our theory of change called the Passport to Self-Sufficiency. And for anyone that wants to take a dive into that, please call me, because we love talking about this whole theory of change and our latest evaluation of how this is moving our families out of poverty. But with this, we have what we call a two-generation approach, which is coupled with mobility coaching for our adults and our children. Our children actually have their own youth coach. So from the point of engagement, we go out 5 or so years with our families, even after they've moved into independent housing. But at the center of all of this transformative work really has been the amazing voices of our families. So in their coaching sessions, our families and our children are talking about their hopes, their dreams, their aspirations, and the barriers that just get in the way. And that voice really began to shape our programs, our practices, and our internal policies. And we saw the benefit of this, which allowed us to have more targeted programming and services for their benefit, our families. Their voices have shaped our childcare services, even the meal times that they are gathering, and how we schedule our time around their needs. So we decided with the permission and the encouragement from our families to take it just a step further. They didn't just want to be heard, they wanted to be listened to. And there was a distinct difference, as my daughter, who's an adult person, said to me one day. We had a 20-minute conversation, and at the end of that conversation, she said, "Mom, you heard me, but you didn't listen." Now, you all know, having a child say that to you, that feels like a dagger. So our families were saying that. So with their help, we created this opportunity for our families that we now call our annual listening session. It's a panel of families with lived experience who are sharing very private moments of their lives, but also sharing what's working, what's not working, why they think it's not working, their experiences with mainstream services. They are sharing their triumphs and their disappointments. And out of one of these meetings came the opportunity for the Department of Health and Human Services to respond and say, we hear their voices. And they literally placed a worker at Peggy's Place who began to form a relationship that helped them really to move faster through the process. And it was because of their voice. But one of the things that we have to do with our audience is to give them instructions on how to listen to the voices of our families. And let's be honest, we're all socialized, racialized a certain way. And because of that, we all look through these tinted lenses. We hear through socialized filters, and then we create narratives that usually aren't true. And then we make decisions and create policy based on faulty narratives about the problem. And then we look 10 years later and say, we wonder why that didn't work. So in these listening sessions, we really set a tone to help people shift their thinking and be open to listening. And the benefit of that experience is so empowering to our families. And so now we're at another phase, and that phase is of amplifying the voices of our families. And we recently received a great grant from the Kellogg Foundation, and we've been able to hire community support liaisons who are training our families and our parents and children to be advocates for their voice, to be advocates for themselves. They're learning the power of their voice and how to effectively use that power, to know their rights, to know their responsibilities. I can't tell you how many times I've had and have talked to a parent who has gone to the emergency room or to the hospital or to the doctor's office, and they didn't have a clue about what was happening. They got some instructions, they got some medication, but yet they didn't feel, as they describe it, as having any power. It was as if something was being done to them and they weren't engaged or involved in that. So we're really excited about the phase of this work. And I'll wrap it up with this. This is what we do know. Empowering the voices of our families is good practice. Listening and including that voice is even better practice. And we know good policy comes from good practice. So the more that we are engaging our families and allowing them to own and share their stories and their voice, the more empowered they become. And the more empowered they become, the healthier they are. And the healthier that they are, we know there are better outcomes for our children.
Oh, that's so wonderful. I mean, really, it's moving. Thank you, Cheryl. So I'm going to pivot to Conrad Mallett, who is from the mayor's office. And we are so excited I don't know about anybody else, but as a policy wonk and a former city employee, I am so excited to give you a platform today. And the reason I'm so excited for this particular topic is because what we are hoping that you'll talk about is ARPA and the $800 million that's coming that's coming to Detroit. But most importantly, Conrad, when we talk about poverty and municipal government, it's all bad, right? It's policing, it's poor infrastructure, it's blight and blight improvements. It's all of the negative aspects. And there is an opportunity here. And the mayor's office really took a big risk and some leadership and making this a much more inclusive process in terms of the ARPA process and how you would make decisions for those resources. And I think, being very optimistic, that it created a shift in how we think about public resources coming to neighborhoods, especially in neighborhoods that are truly, truly disinvested and truly low income. So I'm hoping that maybe you can talk a little bit about that process and where you all are in the process, and what you hope to see for the future as well.
Thank you very much, Anika. You know what, Cheryl's presentation was particularly important as it built off what Luke shared. Luke mentioned a city initiative called the Community Health Corps, which is a part of our ARPA framework that is the result, frankly, of 69 different community listening sessions that we had as we shaped with City Council. And I really want to make sure that people hear that with City Council, our approach to how to use this one-time opportunity. I'm up here in Lansing, and I think it's important. There is a great recognition that this is not once in a lifetime. This is one time. This is never, in my judgment, ever going to happen again. Therefore, the moral and ethical responsibility we have to be careful stewards and to follow the guidance that Cheryl provided, and that is to recognize the difference between hearing and listening, and then acting upon the voices of the people that you supposedly are listening to is critical. The Community Health Corps was born out of the mayor's recognition, along with City Council, that we were not doing enough for the persons at the lowest income strata who are experiencing that 43% population that is living below the poverty line. That we had to have an organized response to dealing with the issues of extreme poverty, number one. But number two, as Cheryl intimated, she said, we're with these families for 5 years. One of the things that Dr. Martha Wilson talked about when she was running Matrix was that poverty is going to be necessarily a difficult journey, and government recognizing there is no silver bullet. Therefore, it has to be an inclusive approach. It has to be one driven by dignity and respect. And one of the things when I was talking to Dr. Wilson, she said, Conrad, let me be clear with you. Many of the persons that you are going to interact with, when they are setting goals for themselves, they're not going to be the goals that you think they're capable of achieving, and you cannot impose on them what you think your middle class values ought to be shared by them. You have to accept in a respectful manner that their goals may be different, may be shaped by a different life experience, but your responsibility is to provide for them a safe foundation where quality decision-making can be done. So we are committed through the CHC to taking people out of detrimental, unsafe housing circumstances. We are dealing with the immediate food insecurity needs that they have. We are diligently trying to put them in safe, temporary housing, and temporary, Anika, for us is 1 year. Temporary is not 30 days. Temporary housing is 1 year where you can catch a serious breath. We are trying to deal with the issues that are affecting your children and their mental health, as well as yours. Poverty is a traumatic experience. Everybody is suffering from some level of PTSD, and it has to be as Cheryl pointed out, our case managers are involved in a coaching a relationship, an advocacy relationship, where we're making sure that they are getting the access to the social service programs that they are entitled to receive. All of our clients are re-enrolled in most instances in social services with the state of Michigan. Some of them for the first time are getting their Medicaid card, to which they are all entitled to receive. But beyond that, not just getting the card, but finding a way to connect them to a physician, even if it is in an FQHC, a federally qualified healthcare clinic, so that people can find their way and sometimes into their first doctor visit, connecting them with something as basic as seeing a dentist sometimes for the first time. So we have right now 276 families that are in what we call active case management. We probably stole from Cheryl the concept of a passport, where people are moving along a continuum where they are achieving goals that set jointly with their case manager and themselves. We have an intimate relationship with Detroit at Works, so that at a point where access to a job is something realistically that can be envisioned and discussed, we have the availability to slot them into a program that they have identified they want to participate in. It's a process and it's an expensive one, but getting to ARPA, it is in the ARPA budget for $27 million. And you say, well, Karen, that's not nearly enough. And you're right. But as we prove out, as Cheryl is doing in the work that she does, as we prove out that the work that we're doing has a meaningful outcome, and that is direct, that is something, Anika, that's important. These ARPA dollars, the federal government is not asking just for productivity measures. That is, how many families did you contact? They want to know, what are the outcomes, and did the work that you do actually produce a positive outcome for that family? And that's what we are actually in affiliation with U of M's Poverty Solution, measuring, so that as we have to report to the federal government how we spent these dollars, that we actually are able to show more than productivity, which is number of families touched, but actually outcomes achieved. Beyond that, we, with the community's input, we are going to utilize this, frankly, one-time opportunity to do what we can to prepare our city to be more industry ready. Take, for instance, everybody on this call knows where the Packard plant is. We've got to knock that down. And if we knock that down, guess what? We're going to have 50 acres of land, Anika, available for an industry to come in to supply jobs. So this is one time where we actually can say we are preparing ourselves to compete with Kentucky, who has acres and acres of virgin land. What we'll be able to say is we have acres and acres of land next to a freeway, right, with a trained population that is ready and willing to work and using, frankly, the energy that's coming directly from the child tax credit to pay them a living wage, which, as we know, is not $15 an hour. A living wage is $19 an hour.
That's right. Let's
really be clear about that. You can't live on $15 an hour. And saying we're going to attract a bunch of $15 an hour jobs in Detroit, we have not done much. If you take a look at the extraordinary work that my colleague Nicole Sherrod-Freeman is doing as the head of economic development and workforce development, when I say that we have a prepared workforce, we are the talent agency for Amazon. We are the talent agency for Stellantis. We are the talent agency for FlexenGate. And as we go down the list of priorities, so industrial land, workforce development, the CHC, think about this. We're going to spend $50 million on home repair. Now, I'm in Lansing right now because, as you saw in the newspaper, we said that we were going to repair 1,000 roofs. We've had 5,000 people in 3 days apply for the assistance. So what we said to the state of Michigan is that we've invested $50 million. We would like you to match our investment. And even 2,000 roofs won't be enough. But if we can create the momentum in tandem with all of the other programmatic steps that we hope to take, the industrial land development, the Joe Louis Greenway, small business initiatives, which will create an atmosphere where we can give grants, not loans, grants to small business people to start their business, and then help them locate in neighborhoods that can support the business that is responding to community need. Think about that for a minute. We're going to put a business in a community that's going to be selling a product that the community says they need and want. And this is what we're going back to the idea. This is what data can do for you. You see what I'm saying? We can talk with the community about the housing needs that they have. We can talk to the community about the services that if they were available to them, they would buy. We can talk with the community about the affordability of the housing that's available. And in many instances, there ain't no housing. So it's not available, and because it's not available, it ain't affordable. So this really is the role of government. And what we have now is this one-time opportunity, if we can really figure it out between the federal government, the state government, and local government, to create a circumstance where organizations like Greenlight, organizations like COTS can really understand what's available, and we can create some seamlessness. So when Cheryl is trying to permanently house a family out of COTS, we can create a transition for that family into housing. If they are prepared and part of their goal setting, they are looking for employment, we can facilitate that because there's a job on the industrial land site that we've cleared that they can get to based on the transportation that we have resurrected. So the possibility of creating excellence for once for the people who need government to function at its best. This is what the real opportunity that we have.
Wow, Conrad, I think this might be the only time they will let you off of the 11th floor. Because that was amazing. Thank you for that. And I do want to get to more of a conversation between the two of you. And I'm really sorry that Luke Schaefer had to leave. For those of you who missed his message, he had a memorial service at the University of Michigan for a student, unfortunately. And so he had to step off early. But one of the things that I think is really important that we can talk about, I have two questions that I'm hoping we can get to before we go to questions to the public, is one, I think there is a continuum, right? From deep poverty and homelessness that the majority of the people that Cheryl is working with. And then there's a continuum there in Detroit, because not everybody is at this level of deep poverty where we have to organize social programs for this. But we also need to organize ourselves to make sure that people are thriving and growing and staying in Detroit, so that once they get that $19 job, Conrad, that you're talking about, they don't move to Southfield. And that's that's where I get anxious, right? I want people to be able to stay here. And so I'm wondering if so that's my first question. And then I have another question after that. So around including kids in these conversations around what should happen for their own future. So maybe you both can talk a little bit about what that continuum looks like in order to think about stabilization and thriving here in.
I'll just add a little bit into what we're watching, and I'll bring a terminology that we all are very much aware of, and that's this cliff effect, right? So we have families that say secure a job, and once that job kicks in, they get the first check, but they are not making, $20, $30 an hour. That's not happening. But because of our policy and our practices, governmental practices, that family gets less, right? Less benefits. And then there's a decision to be made, right? Whether or not, man, am I gonna move forward? Because this is really hard to move forward with children working, but this safety net, which was there to help me, now has been removed. And now technically I'm really back where I am again, right? And so those are things that, as we talk about policy, that we have to think about, the why. We have poor people jump through more hoops than anybody. It's just ridiculous. It's ridiculous. So those are the things that I think about. I throw this out, childcare, the whole aspect of childcare. And what people, I think, don't realize is that the state of Michigan, one of the few, is still the only ones who will not recognize, and I'm talking about homeless people, recognize them where they automatically will get the subsidy. That's one thing. Other states have transitioned to not having to prove that. But the other thing is that many people are not aware that when you go and ask for that subsidy, the one big hoop you have to jump through is disclosing the father. I always ask the question, what does that have to do? What does that have to do with a child? So these are some of the barriers that just get in the way and that quickly impact the life of a child. Just disclosing about, and there are many reasons, and we don't have to have this discussion. That's a whole nother conversation.
That's the next panel, right?
Yeah, that's another panel of why people don't disclose, but it's a requirement in order to access that. So these are some of the things, I can't even think about. And some of our parents, it's very hard to even think about the next leg, just because every time you get that one step, there is something that is snatched, that's put in place through policy, and you're back still trying to crawl out. So those are things we have to talk about and think about as we make policy decisions, and using the voice of our parents. Some things I just think we overthink. We just overthink it.
So Anika, here's what I would say. I think Cheryl's 100% correct. I think as well, though, you raise an interesting issue. If you listen to the community conversations that we had a number of persons come on, and I'll use this particular example. A woman came on the phone. Hello, I'm 55 years old. I'm a Detroit public school teacher. I am all in favor of seniors getting a new roof, and I am all in favor of low-income persons who live in substandard housing to be in better, safer, affordable housing. But I make $50,000 a year, and I can't afford my new roof either. And I wonder what is there for me. And so that, frankly, Anika, is part of the conversation that we've had up here in Lansing is listen, you've got $6.5 billion The city of Detroit got 826 million. They got 6.5 billion. As you're thinking about how you're going to spend that money, do you think that you could allow us to expand the range of services that we provide and not turn your nose up at the $50,000 a year school teacher and wonder if we can fix her roof too? And think about the knock-on effect of stabilizing that young woman's house and allowing her then to not have to take out a loan against her home to fix the roof, but actually allow her to say, you know what, maybe what I'm going to do with the money that I would have spent on the roof, maybe I now can put in a new kitchen and actually raise considerably the value of my property, which would then lift up the entire neighborhood that she lives in. So yes, I mean, I think that what we have to have, and this is the role again that people like you, Anika, have to demand that government play, and that is, listen, you guys have to step into the hard discussions. That's why we pay you. And you know, Cheryl is a powerful voice representing the people that she serves, but that lower middle class person is struggling differently, but nevertheless struggling. And so, and then getting to the child care portion of this, let me just say, there are 2,000, think about this for a minute. There are 2,000 children in Detroit as we speak who are eligible for the Great Start program, whose parents don't know about it and they're not in it. And what we're trying to do up here also today is get the state legislature to allow the city of Detroit to take the responsibility to find those 2,000 kids, inform those parents of what's possible, and to be judged by the success that we achieve of getting those children into that already paid for pre-K program. So think about the life-changing circumstance that those kids would be in if they actually got to kindergarten from the circumstance they're in, but got to kindergarten ready to read. Think about that. Their life trajectory, Cheryl, is completely different. They're on a different track, completely different track. They'll never see Cheryl. They'll never need her services, neither them or the parents, because, and so, yeah, I mean, but again, to me, this is the one-time opportunity.
That's right.
The money is there. It's not being spent. We think about this. We're trying to convince the legislature to allow us to take the responsibility to spend the money. And it ain't been greeted kindly by some people who are members of the educational industry, but they ain't doing the job and we're volunteering. So it's work we're good at. We know how to start these fights and end them, and we're going to win this battle as well.
I want to move to questions from the audience. We have like 15 questions that came in advance of the panel, but I do want to start because we had a question from the audience who's here with us right now. Aaron said, I love the passion. I love it too, Aaron. Isn't it awesome? It's exciting. So we have a question from Kayla Guillory, who talks about trusting individuals to spend money the way they see fit. That there's a lot of distrust and fear, and I think this isn't unique to Detroit. I think there is a distrust of especially low-income people who are doing without, that we assume that they can't manage their money. And so we need to tell them how to use it.
Right.
I would love to hear your opinion on that one, briefly. I could say a lot, but I want to hear how you all feel about that too.
Yeah.
So
can
I'll
say
be
a lot.
quick so we
Say a
can,
lot too.
yeah, so I'll be real quick and then so that Cheryl gets a chance. During the CHC run up, we were dealing with COVID-19 dollars. We made almost $1 million, Anika, in cash grants. And we accounted for every single penny. We didn't ask people what the money was being spent on. We do know in 99.9% of the cases, it was spent on basic needs, utilities, and those kinds of things. That as David Holmes, former state senator, used to say, poor people are just poor, not stupid. They can take care of themselves.
Thank you. And thank you for ending that with that statement, because let me just add on to that. And that thinking honestly comes from a history. And I mean a history that goes all the way back hundreds of years from, we can, add the whole thing of how racist that can be.
Yes.
Because it comes from that, like we know better then, and so therefore we have to decide for, and that is in my 30 something years has never been the case. That in fact, people are the experts of their lives. They are the experts of their lives. We recently, during COVID, received a huge grant from an organization, and they simply said this: we're giving you these tens of thousands of dollars. Every family, give them 500, in fact, put it directly into their bank account. There's no strings, nothing attached, nothing, just $500. And the thought, I said, wow, for the first time, someone has stepped up to actually believe that people are going to do the right thing for their families, and they do the right thing. So that has been our history of that. But something I do want to say, Anika and Honorable Conrad, of this, because just in case we miss this question that comes up, I want to go back to the children and their voices. This has been a very difficult time for our children. And I know we want to believe that our kids are resilient. They're gonna be fine. COVID came and our kids would do fine. Our kids are not fine. Our kids are not fine. One young man said this, and these were his words in one of his coaching sessions. He said this. He said, I feel disconnected. And he's 8. He's using, I feel disconnected. And 2, nobody sees me. And so we asked him, like, what do you mean? We see you. And he pulled up his mask and he said, nobody sees me. And what he was basically saying was, our kids are used to being touching each other. They're used to expressing themselves, and people see their affect. All of that has been shut down, and I am a proponent for wearing a mask. But our kids, they aren't used to going to school and doing this. So what we're seeing now is this uptick in child depression. We're seeing suicide attempts at a rate that we've never seen before. And we don't know, we really don't know, like, how this is going to pan out in the future. And so I'm saying this to make sure we are paying attention, because kids do speak, they will speak. They are speaking, or they will act out. They will get your attention one way or the other. We all know that, right? And so let's make sure that we are listening to our kids, because they are telling us how they're faring, and it is not well. And so we've got to pay attention to what this means for their future, but have adequate and appropriate interventions right now for them to get the help that they need.
Agree.
That is really moving. I'm going to ask one last question before we wrap up. There's a question that's in the chat today, and it's related to a question that came pre-submitted about who are we in business with and what are they doing to assist in the overall mission. And then Aaron Wilbur asks, we should start with our relationships and coordinating the local business sector, who is our attorney, who is our insurance agent, and what are they supporting, and how are they in this fight for poverty, fight for our children, fight for families as well. But it also leads me to another question that I think is related to this. The headline in Core Business Magazine this morning, and so Conrad, this is more for you, but I think this is also really relevant to you, Cheryl, was that business leaders have a plan for ARPA to help with Michigan for $6 billion. And you read the article, and I mean, what they're proposing wasn't terrible, but it really, this question about who is really making decisions for Detroit, for the region, for the state, that impact the people who we care about, these children living in poverty, and how do we actually balance that a little more? Now, it would be easy to say, well, they have all of the money, it's business leadership, but there also has to be, it can't just be an act of charity to include the voices of people who are most affected.
Absolutely.
Yeah.
Absolutely.
So can you
and the business leaders don't have the money, Anika. Government does.
That's right.
Yeah, and so I'll be real clear. Ain't nobody telling Mike Duggan how to spend the money. Nobody telling Conrad Mallett how to spend the money. Now, we are interested in partnerships, and as you know, particularly with the philanthropic community, and we are anxious to hear what our partners think could be helpful. And you know, we don't want to be dismissive of anybody's good ideas or anything like that. But I'll say this with no hesitation, that we intend to continue to listen to the voices of the community. And part of the reason that I think we have been successful to date is because we were active on the front end of including the community. And as these things begin to roll out, we intend to be just as vigorous. We are setting for ourselves, beyond what's already required by ordinance, setting for ourselves community interaction opportunities around all of these projects. There's no question, to Cheryl's point, we got to do a better job. We are not reaching deeply enough, but I want to assure everybody who's listening and a part of this program, nobody's dictating how this money is going to be spent, at least not in the city of Detroit. I guarantee you that. We're going to have a new, very vigorous city council, and they're not here to take prisoners, and nor are they here to take orders. So they can we might spend the money inappropriately, but it ain't gonna be because somebody told us do it this way. That ain't gonna happen.
Cheryl, do you have any closing remarks?
I just want to say amen. Amen to that. Amen to that. And you know, at the end of the day, let me just say that, and I'm glad you ended with that, because we have to keep our voice, you know, around the table. I think that is the most important bit of advice and encouragement that we can give to our leaders, whether it's, you know, here in the city, at the state level. We have to find a way, not just to keep them, but we need to have it embedded in government, right? That it's a automatic thing. We don't have to think like, oh, let me. They should automatically be at the table.
That's right.
I agree.
I want to thank you both so much. This has been so much fun and so informative. I have really enjoyed it. I'm going to turn it back over to Rishi, who will likely fire me and never ask for me to do anything else again. This panel is completely out of control.
Come on now.
Thank you so much, Cheryl P. Johnson, the Honorable Conrad Mallett. Thank you. Rishi?
Of course. Thank you guys. And also thank to Luke Schaefer as well. Unfortunately, as you know, he had to leave a little bit early because of a tragedy at work and with his friends. But look, let me just say again, I appreciate this dialogue as a starting point. We have a lot of great comments and questions coming in from our participants. We want to continue that. And as we say in Greenlight Fund, we don't talk to just talk. There needs to be action afterwards. And this is part of that continuing conversation to action. So thank you guys. Really appreciate your time. Anika for moderating this vibrant group throughout our hour or so together. Real quick.
Yeah, I think, hey, Rishi, I think that what you've learned from this is don't put me and Cheryl on the same panel.
Definitely appreciate y'all. So in terms of our next shift series, we're doing this once a month this season. You can register now for our next shift series event. This is around education, leading the class. How do we uplift the teaching profession with and for educators? That'll be on November 10th, moderated by our CEO of Skillman Foundation, Angelique Powers. And we have a great panel that'll be joining her to talk about other important topics y'all are interested in. And our third installment will be on December 8th. And the theme on that is building change that lasts. And this will be a conversation with Black women who are scaling social impact here in the Detroit area. And that'll be also a really intimate conversation about what is working and where we need to do better to support each other. So the full lineups, the registration will be online, shiftdetroit.org. Again, thank you, panel, for being a part of our conversation today and the participants. And let's continue working hard together to make a better tomorrow. So thank you.
Thank you, guys. See you
Thank you.
later.